Mesothelioma treatment options. Surgery. Surgery is a common treatment option for mesothelioma, especially if the cancer is diagnosed at an early stage before it has spread widely. The main types of surgery for mesothelioma are pleurectomy, decortication, PD. This surgery aims to remove the thin layer of mesothelium from the outer lining of the lung, pleura, and some of the underlying tissue. This type of surgery is often used in early-stage disease. Extrapleural pneumonectomy, EPP. EPP is a more extensive surgery that removes the entire affected lung, the lining of the lung, the nearby lymph nodes, diaphragm, and part of the sac surrounding the heart. This surgery is reserved for early-stage disease. Parietal pleurectomy. This surgery removes only part of the lining of the lung where tumors are found rather than removing the whole lung. It may be used if the cancer is localized to one part of the chest lining. Chemotherapy. Chemotherapy uses anti-cancer drugs that are given through the bloodstream orally or by intravenous, for injection to kill cancer cells. It can be given alone or combined with other treatments for mesothelioma. Common chemotherapy drugs for mesothelioma include hemithorax, Alimta, cisplatin, carboplatin. Chemotherapy may be given systemically or directly into the chest cavity, intrapleural. Radiation therapy. Radiation therapy utilizes high-energy beams such as X-rays or protons to kill cancer cells or stop their growth. For mesothelioma, external beam radiation therapy is commonly used along with chemotherapy after surgery to destroy any remaining cancer cells and reduce the risk of recurrence. Intensity-modulated radiation therapy, IMRT, allows for a more precise delivery of radiation to the tumor areas. Photodynamic therapy, PDT. PDT uses a light-activated drug and a type of laser light to damage and kill cancer cells. The patient is given a photosensitizing drug that collects more in cancer cells than normal cells. The drug makes the cancer cells sensitive to a particular wavelength of light. A laser is then used to shine that wavelength of light on the tumor, which triggers the photosensitizing drug to produce an oxidative form of damage that destroys the cancer cells. Thoracoscopic pleurectomy/decortication. This is a minimally invasive variation of PD surgery where thin, lighted tubes called thoracoscopes are inserted between the ribs to allow the surgeon to see inside the chest cavity during surgery with small incisions rather than a large chest incision. Proton beam therapy. Proton beam therapy uses a beam of protons rather than X-rays to irradiate tumors. It causes less damage to surrounding healthy tissues. Some research shows it may work better for certain mesothelioma tumors near vital organs. Clinical trials. Clinical trials are research studies that test new treatments and combo therapies. Enrolling in a mesothelioma-related clinical trial is often a good option as long as patients understand both benefits and risks involved. Some trials combine chemo with newer immunotherapies or targeted drugs. Prostate cancer treatment options. Active surveillance. For low-risk prostate cancer that is unlikely to spread or cause harm, active surveillance involves closely monitoring the patient with regular checkups and testing to check if treatment is needed. This avoids or delays aggressive treatment. Radical prostatectomy. A radical prostatectomy completely removes the prostate gland during surgery. It is one of the main treatment options for localized prostate cancer. It can be done via open surgery, laparoscopic, keyhole surgery or robotic prostatectomy using the Da Vinci system. Radiation therapy. External beam radiation therapy, EBRT, uses X-rays or protons to kill cancer cells, shrinking or destroying tumors. It is often combined with hormonal therapy. Brachytherapy implants radioactive seeds directly into the prostate gland. Proton beam therapy, similar to EBRT but utilizes a beam of protons instead of X-rays to better target the tumor while minimizing exposure to surrounding healthy tissues. This helps reduce potential side effects. Cryotherapy, also called cryoablation. This minimally invasive treatment freezes and kills cancer cells by inserting a cryoprobe through the skin and using extreme cold produced by liquid nitrogen or argon gas. Hormone therapy. also called androgen deprivation therapy. It reduces levels of male hormones, androgens, like testosterone that fuel prostate cancer growth. Methods include the LHRH agonists, antagonists that block testosterone production, anti-androgens that block its effects on cancer cells, or surgical castration, often given before or after other therapies. High-intensity focused ultrasound, HIFU. This newer treatment uses ultrasound waves focused like a lens to generate heat that destroys tumor tissue without surgery. It may help avoid sexual, urinary side effects of other options. Chemotherapy. While rarely used as primary treatment for localized prostate cancer, chemotherapy with docetaxel or cabazitaxel plus prednisone can help slow cancer progression in advanced or metastatic cancer not fully controlled by hormone therapy. Newer chemo options continue to emerge. Immunotherapy. Immunotherapy uses the body's own immune system to fight cancer. Checkpoint inhibitors like pembrolizumab work by releasing brakes on T cells to enhance tumor killing. Other immunotherapies under study include therapeutic vaccines to trigger an immune response against prostate cancer cells. Clinical trials. Enrolling in a prostate cancer clinical trial offers access to newest treatments not yet standard, often combining established therapies with investigational drugs in hopes of improving outcomes even more. Some trials explore using immunotherapy earlier in treatment. Choosing the best treatment plan requires considering factors like cancer stage, grade, PSA levels, patient's overall health and preferences after discussing benefits, risks and side effects of each option with a board-certified urologist-oncologist. For some patients, active surveillance initially before switching to another option may be most appropriate. Care at a top cancer center enhances access to latest advances.